When you picture a severe burn, the first thing that comes to mind is probably a terrible skin injury. And you're not wrong, but that's just the tip of the iceberg. A major burn isn't just a problem in one spot. It's a full-body medical emergency. It's an event that triggers this catastrophic chain reaction inside you, a systemic crisis that pushes the human body to its absolute limits. And what's really striking is that the story often starts way before any fire. Get this, in some groups of patients, a staggering 80% of adults who are hospitalized for burns have some underlying condition. We're talking epilepsy, mental health struggles, substance abuse, that played a role in them getting injured in the first place. It's just a crucial reminder of the very vulnerable people at the center of these medical emergencies.
So what is actually going on here? How does an injury to the skin spiral into a total body crisis? Well, that's what we're going to break down. Let's get into it.
Okay, so first things first, we have to understand that the initial burn, it's just the spark. What comes next is this incredibly complex physiological cascade that puts every single organ system in the body at risk. Just to give you a sense of the scale, let's look at the numbers from the UK. Every year, you've got about 175,000 people showing up at an A&E for a burn. Out of those, 13,000 need to be admitted to the hospital. But the group we're really focusing on today, it's those 1,000 patients whose burns are so severe, they need what's called massive fluid resuscitation just to stay alive. Right, so in the first few hours after a major burn, two immediate life-threatening dangers pop up. And believe it or not, neither of them have to do with the burned skin itself. So the first threat is one you can't even see. If someone was trapped in a fire, they've been breathing in superheated gases and smoke. And that doesn't just burn you on the outside. It literally scorches the delicate lining of your airway, your nose, your throat, from the inside out. And this internal injury is often the most urgent danger of all. Medics are trained to be on high alert for some huge red flags. Any burns around the face and neck, hearing that the person was trapped in a fire, a change in their voice like it's getting hoarse, or this awful, harsh, vibrating sound when they breathe called stridor. All of those are massive warning signs that the airway is in serious trouble. And here's why it's so critical. The burned tissue inside the throat starts to swell, and it swells fast. Within a matter of hours, that swelling can completely close off the airway. It's why doctors won't wait for the person to be struggling for breath. They'll proactively intubate them, putting a breathing tube in, because waiting for obvious signs of distress is just waiting for disaster. Okay, so that's threat number one. The second immediate killer is something called burn shock. And no, we're not talking about emotional shock here. This is a physical, full-blown collapse of your circulatory system, all kicked off by an out-of-control inflammatory response that takes over your entire body. Imagine your whole circulatory system is like a high-pressure garden hose. Well, the body's massive inflammatory response basically pokes thousands of tiny, microscopic holes all over it. All of a sudden, huge amounts of water, salts, and proteins start leaking out of the bloodstream and into the tissues. Once a burn covers more than about 15% of your body, this fluid loss gets so bad that the whole system starts to fail. That's burn shock. So, to even begin to fight back against these threats, the medical team has to know exactly what they're dealing with. They need to systematically figure out two things: the size of the burn and just how deep it goes. So for the size, the percentage of total body surface area that's burned, they have a couple of quick tools. For smaller, patchy burns, they use the hand rule. The patient's own hand, palm and fingers together, is about 1% of their body's surface area. For bigger burns, they use the rule of nines for a quick estimate, where different body parts get assigned a percentage, like 9% for a whole arm or 18% for a leg. Getting this number right is absolutely critical for treatment. Okay, then there's the depth. They figure this out by looking at a few key things. A superficial burn, it's going to be pink, painful, and it'll blanch. That means if you press on it, it turns white for a second, which shows blood is still flowing. But a full-thickness burn, it's a whole different story. It looks leathery, it can be white, or even charred. And because all the nerves in the area are destroyed, it's totally numb. There's no blood flow to press out. And this comparison just says it all, doesn't it? On the left, you've got that pink, moist surface of a superficial burn that's probably going to heal on its own. But on the right, that pale, leathery look is a full-thickness burn. Every layer of skin is gone, right down to the fat. That wound has zero chance of healing without major surgery. So once the damage is fully assessed, the battle for recovery really begins. And this is an all-out medical assault to get the patient stable, restore the body's balance, and start the incredibly long process of rebuilding everything that was lost. The very first priority is to fight that burn shock. Remember the leaky hose? To counteract it, you have to pour fluid back in. A lot of fluid. They use a calculation called the Parkland formula to figure out exactly how much. And we are talking about giving a patient liters and liters of IV fluids in just the first 24 hours to keep their circulatory system from completely collapsing. Now, here's another huge problem. When a deep, full-thickness burn goes all the way around a limb, or even the chest, it creates a deadly tourniquet effect. The burnt skin, called eschar, gets tough and tight, like a leather strap constricting the body from the outside. The solution is a procedure called an escharotomy. Surgeons make these long cuts right through that leathery eschar. Now, it looks intense, but they're not cutting healthy tissue. They're basically cutting a release valve. The incision lets the swollen tissues underneath expand, which restores blood flow to the limb or allows the patient's chest to actually rise and fall so they can breathe. For those deep burns that just can't heal, the only way forward is skin grafting. It's essentially a 3-step process. First, they excise the dead tissue, carefully shaving it away until they get down to a healthy, bleeding surface. Second, they harvest a paper-thin layer of healthy skin from somewhere else on the body, like the thigh. And finally, they apply that graft onto the clean wound, where it acts like a permanent, living bandage. But even after the fires are out and the surgeries are done, this fight is so far from over. Surviving the initial crisis is really just step 1 on what is an incredibly long and difficult road home. Think about it. Healing a massive burn takes a monumental amount of energy, so the body's nutritional needs just go through the roof. Then there's the daily, often painful physiotherapy just to stop joints from locking up. Patients have to wear special pressure garments, sometimes for years, to manage the scarring. And all of this is happening while they're trying to deal with just an unimaginable level of psychological trauma. Yeah, the healing process itself can sometimes go into overdrive, creating these thick, raised, painful scars called hypertrophic scars, like you see here. And managing them is a total marathon. It takes months, even years, of pressure therapy, silicone sheets, and sometimes more surgery. And this quote from our source material just really hits it home. It says, "A major burn is an overwhelming event outside the normal experience, which stretches the patient's coping ability, suspends the patient's sense of safety, and causes post-traumatic reactions. It basically shatters a person's fundamental sense of safety in the world, leaving behind this deep, lasting trauma." So, when you look at the whole picture, from a single moment of injury to a total body crisis to a years-long battle to recover, the journey of a burn patient is it's an incredible story. It shows us just how fragile the human body is, but at the same time, it reveals this almost unbelievable capacity to endure, to fight back, and to heal. It really makes you wonder, what does all of this teach us about the very nature of resilience itself?